the second most common complaint that we see in volleyball players in our office is going to be something related to knee pain. Now I want to mention to you that there are different causes for knee pain, especially in adolescent populations. So there's two that we commonly see. One is going to be something called Osgood-Schlatter's, which is a long fancy name for pain that is specifically right in this region here. And the reason why I'm mentioning that is because it requires a little bit different of a rehab protocol. Usually focused more around like load management, so making sure that we're not doing unnecessary jumps and stuff like that, and versus pain that's going to be specific more right around the kneecap, which we can treat very well. We can treat Osgood-Schlatter's pretty well too, but I do want to make sure that we specify that there are different causes for knee pain, and it's not just a general term knee pain. Exercise number 1 is going to be a foam rolling through the front part of the thigh. So you can take a small little foam roller here, and we're going to make sure that we're kind of methodically moving up and down the quad muscle, which is the muscle here, and that goes into and attaches to your patellar tendon, or becomes your patellar tendon, and helps to move your lower leg. So what Zach here is doing is going through knee flexion and knee extension to lengthen and shorten the quad, while he's methodically working through the different regions of the quad muscle, making sure that we're hitting the outside part, so out in this region, the middle part, and also the inside part, maybe even getting a little bit of the groin in there as well. And he's working through this methodically and doing it in a way that he's trying to relax through his quad muscle, and he's not fighting the foam roller through this. So that would be exercise 1. We want to try to improve some of the tissue quality in the front part of your thigh. Exercise 2 of knee rehab in a volleyball player is going to be a wall sit. We can do this again at practice. You can do this at home. But the goal here is to strengthen the quad and strengthen the patellar tendon in an isometric way, or where no movement is occurring, because Zach is not going to move the wall, or he's also not going to move the floor. So we're going to go ahead and go into a wall sit, and the angle that we're trying to find is somewhere between 45 degrees and 90 degrees. And what this is going to do is it's going to force him to use his quad muscle here pretty darn hard to keep himself upright. And we're getting a lot of load through the tendon here, your patellar tendon, which comes down and inserts right in there. We do want to mention that we want to try and limit the amount of force that we're trying to drive back through into the wall, because that can put a lot of excess force through the knee joint itself, which might exacerbate some symptoms. So we got to kind of find an angle that works for you as an individual. But again, our goal here is to do 4 or 5 sets of roughly 45 seconds. When this gets too easy, we can isolate to a single leg wall sit. He doesn't have to do that, but we can build then some single leg strength in this isometric way. So this is exercise 2, is going to be a wall sit. We're not trying to do this again to set world records or anything like that, but our goal is to strengthen the quad, strengthen the patellar tendon, and get you back to jumping without knee pain. Exercise 3 of knee pain in volleyball player for you Sting athletes is going to be a wall slide squat. So we're going to kind of progress from a isometric hold of a wall sit, and we're going to try to squat a little bit here. So the goal is to find a good angle here so that our knees aren't traveling too far over the toes, and we're not influencing a lot of movement through the ankle. We want to kind of sit away from the wall, find a wall that's nice and slippery, and go into a squat. And doing it this way is going to really isolate the front part of the leg muscle here, your quads. And again, we're trying to build strength through the quad and strength through the patellar tendon. So Zach can do this for 2 sets of 10 to start, or we can scale it appropriately for you as an individual. But again, the goal here is to build some leg strength and strength through the patellar tendon. So this is a wall slide squat, exercise 3. Exercise 4 of knee pain for you Sting athletes is going to be a single leg box squat. And the goal here is to build some strength through one leg and some stability through your hip and through your knee and through your ankle joint. So we're going to do it left-legged here, and Dr. Zach is going to sit back to the box and then push himself back up using only his left leg here. The goal is to not crash down into the box, but slowly control your way down. So we're not looking for that. We're trying to look for control all the way down and control all the way back up. All right, so the goal again is to build some strength through the quad, some strength through the back part of your hip here, and some control through your ankle joint. And as we continue to do this, you'll get better at it. Your coordination will get better at it, and then we can vary the height of the box. So start with a box pretty high up, get yourself used to it, and then as you get better and stronger at it, you can then go a little bit further, lower and lower and lower. So this was a single leg box squat. Exercise 5 for rehabbing knee pain in a volleyball player is going to be something called a box step down. In this exercise, we're going to be trying to focus on proper landing mechanics, making sure that we're landing on both feet with some softness in our knees and engaging some of the muscles in our lower body so that we can absorb some of the contact. So Zach's going to step up onto the table here or a box, and he's going to step off and land evenly, weight on both feet, and some softness. So we're not trying to thud our way down. He's trying to land nice and soft with some knee bend and really feel some of the muscles in his lower leg engaging to take some of the stress off some of the joints here. So we can do a two-legged to start, where he's doing it here. Nice soft, and we come back up. And a progression from this would be doing one-legged. Once the two-legged gets too easy, we can land one-legged. So obviously we're focusing all the attention on whichever leg that we're choosing to. And again, we're still building some nice softness in our landing mechanics where we're isolating one leg at a time. So this would be a box step down to focus on landing mechanics.